Hello all. Don't forget to like and share the videos while you're listening. First, let's read the question. A 32-year-old male presents to the emergency department with severe lower abdominal pain and hematuria following a road traffic accident.
His vital signs show a blood pressure of 100/70, pulse 118, and respiratory rate 17. On examination, there is tenderness in the lower abdomen as well as rebound tenderness. A CT scan of the abdomen shows a rupture in the bladder wall with urine leakage into the intraperitoneal space. Laboratory tests confirm elevated serum creatinine 2.3 and blood urine nitrogen 32, consistent with renal impairment due to urinary extravasation.
Which of the following regions of the bladder is most likely injured?
A. Anterior wall, B. Base, C. Dome, D. Neck, E. Posterior wall.
Today we will study about the renal and urinary system. Starting from the kidneys, we know that these are bean-shaped organs present in the back of the abdomen in the retroperitoneum. They are covered by renal fascia to give covering and protection. This may serve as a barrier against any pathologies and is a thick layer that needs to be incised during surgery. It is also called Gerota's fascia. Here you can see the gross structure of the kidneys. It starts at the outer cortex, to the inner medulla, to the major calyx, the minor calyx, the renal pelvis, and the ureter. Relations of the kidneys are relatively important since many organs cover these anteriorly. Dividing the kidney into three regions is helpful: the upper pole, middle portion, and the lower pole. As you can see from the diagram on the right, the various structures that are present in front of the kidneys. Try to memorize this using the table and the image given on the right. The kidneys are supplied by certain vessels, starting from renal vessels up to the vessels to the smallest structural and functional unit of the kidney, that is the nephron. And this flowchart shows how blood circulates through both arterial and venous systems. Carefully try to memorize this with spaced repetition. The blood flow starts at the aorta, goes on to the renal artery, followed by the segmental artery, the interlobar artery, arcuate artery, interlobular artery or cortical radiate arteries, afferent arterioles onto the glomeruli, the efferent arterioles, peritubular capillaries, vasa recta, and so on and so forth, until it drains into the inferior vena cava. You will come across this in physiology as well. Now let's talk about the ureter. You need to know the route of the ureter, that it passes over the common iliac vessels and under the uterine artery in females and the vas deferens in male. Some key points worth remembering regarding the ureter are as follows. Note the narrowest parts of the ureter include the uretropelvic junction, the pelvic brim, and the uretrovesical junction. These are key regions where renal calculi can cause obstruction. The blood supply of the ureters is also important. It is divided into three halves: the proximal portion, the middle portion, and the distal portion. The proximal portion is supplied by the renal arteries, the middle portion by the gonadal arteries and the common internal iliac arteries, the distal portion by the internal iliac and the superior vesical arteries. Gynecologic procedures like hysterectomy or ovarian cystectomy can damage the ureter through inevident surgical trauma or improper dissection technique. Next important structure is the urinary bladder. Take a look at these images to orient yourself as to how the bladder is placed. On the left, we have an image showing that the bladder is shaped like an upside-down pyramid. It has a superior surface, an inferolateral surface, a base, and a neck. Image on the right is a frontal section showing the inside of the bladder. The inside of the bladder has a triangular-shaped area known as the bladder trigone. At the two corners of the bladder trigone, you can see two ureteral orifices. These clinicals are high yield, and it would be best to know the mechanism behind the injuries, the features, and where the urine leaks into. Starting with the dome or the superior wall of the bladder, which is the weakest part, injury to this area usually occurs on a full bladder while wearing a seat belt or fall from a height. Features of this include hematuria and may present with signs of peritoneal irritation. The urine leaks into the intraperitoneal space. As for the anterior wall and the neck, this usually occurs due to a pelvic fracture and causes urinary retention along with lower abdominal pain, and the urine leaks into the extraperitoneal space, that is behind the pubis. The posterior wall is injured again by blunt trauma or pelvic fractures, and this injury causes hematuria along with possible signs of rectal injury. The urine leaks into the retroperitoneal space. The base is damaged due to stabbing injuries or gunshot wounds, causes suprapubic pain, signs of peritonitis, and hematuria again. The urine leaks into the retroperitoneal space. The urethra exits the bladder to release urine. In males, injuries are significant to cover since the urethra has multiple regions, the weakest part being the membranous urethra or the posterior urethra. Anterior urethra or the bulbar or spongy urethra is injured by blunt trauma, penetrating injuries, straddle injuries, and motorcycle accidents. Blood is usually seen at the meatus, along with difficulty urinating, perineal swelling, and more significantly, a scrotal hematoma. If the buccal fascia is torn, urine escapes into the perineal space. Posterior membranous urethra is injured by blunt trauma and crush injuries, along with pelvic fractures. This presents with blood at the meatus, inability to void, pelvic pain, high riding prostate, and urine leaks into the retropubic space. You can see on the right the different parts of the urethra. These images highlight the findings given in the above table. Here you can see in yellow where the urine leaks into and the various parts of the urethra being injured. Now, as for the question, we can see a young male who has presented with lower abdominal pain, hematuria, and signs of rebound tenderness. There's a rupture in the bladder wall and urine leakage into the intraperitoneal space. Which of the following regions of the bladder is most likely injured? So here we know an injury to the dome or the superior wall of the bladder usually results in leakage of urine into the intraperitoneal space. Feel free to go over the answer explanations. Here is the key point. You have to remember that superior wall injury to the bladder results in urine leakage into the intraperitoneal space, and an injury to the anterior wall results in extraperitoneal leakage. Do not confuse bladder injuries with urethral injuries. I hope that was sufficient, and I will try posting some follow-up questions for recall. Happy learning! Don't forget to like the video and subscribe to the channel if you haven't already.